Department of Health is calling on healthcare workers to register before going to hospitals to be vaccinated. This comes as the country is continuing to administer the Johnson & Johnson jab. But some health workers have raised concerns about the process. Let's find out now how some private healthcare sector views the vaccine rollout so far and what success would look like from their perspective on the ground. Let's discuss now with specialist physician Dr. Adri Kok. Dr. Kok, good morning and thank you very much for your time. Well, it's several days now since the Johnson & Johnson jab has been rolled out, but over the weekend we also saw a little bit of challenges at Steve Biko Academic Hospital, but the health department saying everybody needs to register even before they go to a vaccination centre. What's your view about the process so far?
Look, I think there's a few aspects. First of all, that the vaccine is here and that we can get it rolled out is absolutely crucial. So I think really that is the most important aspect, that people are positive about it, that they're doing it. Obviously, it's the first week of the vaccine rollout, so there are bound to be some issues. I think that Baragwanath wasn't quite ready because they're dependent on volunteers. So a weekend is obviously difficult, but I think they'll be on board today. I know that eNCA assisted at Steve Biko yesterday under Dr. Richard Friedland to ensure that the process was as seamless as possible. But again, there's only 80,000 in the entire country. So each vaccine site only have a certain number of vaccines available. So people can't just arrive and think they're going to get vaccinated. That's the reason for the registration. It's very difficult to get everybody vaccinated at once. It's not going to happen. It has to happen in batches, as we've seen, and every 2 weeks there'll be 80,000 of the vaccine distributed across the country. So people just have to be a bit calm, relax about this. I know everybody is quite eager to get the vaccine done, but this is why the registration process is so important. And I know some people feel they should be first, this one should be first. You know, for me, our nursing staff working in the critical care area, casualty theatres, probably would be the people that's most at risk. And then whatever doctors work in those situations as well. But again, it doesn't mean that the radiographer isn't important, or the person from the laboratory, or the cleaner, or the porter. But again, it has to be done on a voucher system to ensure that if you get to the site where you registered, there would be vaccine available to vaccinate you.
Okay, now your colleagues. Sorry, you said the people must do what to the process?
They must just give the process time. You know, they're not going to vaccinate the whole 500,000 people in the first week. It's going to take time to roll it out. And as the 80,000 arrive each 2 weeks, I heard Dr. Glenda Gray this morning that they're aiming for 40,000 people vaccinated by Wednesday. Now, to get that achievable, one would think that there needs to be a 24-hour vaccine process, or they need to open more sites, which I know is in the process of being done. Because it's a phase 3B trial, there has to be documentation that has to be done, and they also have to be sure that the process of administering the vaccine is done under very strict guidance of the GCP process, which is the good clinical practice.
Okay, now, Dr. Kok, you mentioned a number of things. Just to ascertain one thing, I mean, in the private healthcare sector, you're a specialist physician. Do your colleagues and people who belong to your private healthcare sector associations, do they get the right communication from what you've just explained? Are you getting the right information from the Department of Health?
Yeah, absolutely. You know, people don't always attend the meetings and they don't read the emails. So we try to communicate as widely as possible, but they sometimes interpret things in their own way and they don't listen. There are certain circumstances, very rarely, where a person is refused because they say they don't reach the indications. That obviously has to be addressed, but those in private practice can be done through their hospital manager, who can then escalate it to the appropriate people organizing the vaccine sort of rollout to make sure that the right people initially, everybody should get it, but that the more urgent people, if I can put it that way, get vaccinated first.
Are you satisfied? Are you satisfied at this stage from what you've seen and the attempts to fix the challenges that we saw playing themselves out at Steve Biko Academic Hospital at the weekend? Are you satisfied that going forward things are going to be different? There's going to be a better understanding of how the process works by your colleagues?
Yeah, so I think the most important thing is that we need more vaccine sites. To have 2 big ones in Gauteng is not enough. And I know that they're in the process of working out how to do that logistically, because apart from administering the vaccine, you've got to have this process of gathering data. So each of the sites, you've got to have a registration process. You have the person giving consent for the procedure. All of that's part of a phase 3B trial setting, because it's under those circumstances that the J&J vaccine has been allowed to get to South Africa. So it is a bit more cumbersome than a normal vaccine, which is simple. You can get it done anywhere. It has to be done under these circumstances because of the unique situation with the J&J vaccine. So more sites absolutely crucial, and hopefully that will happen today. As they get more sites rolled out, because that is really the most important, is to get accredited sites that can give the vaccine and to ensure that they do the documentation as required.
Yeah, you couldn't be any clearer. We'll have to see what the Department of Health does from you in the private healthcare sector, calling for more sites in Gauteng. Thank you very much, Dr. Adri Kok there, a specialist physician, speaking on behalf of a section of the private sector healthcare, calling for more COVID-19 vaccination sites in Gauteng. 2, she says, not enough. That's Chris Hani Baragwanath Hospital in Soweto and the Steve Biko Academic Hospital in Tshwane. Hopefully the Department of Health will move in that direction. Now, the